Okay, so the scenario that I'll use is that I've been sent to a patient with a reduced level of consciousness following an unspecified drug overdose. So when I arrive on scene, I need to do my normal checks. I'm checking and considering my danger. I'm having a look around at the scene and thinking about whether there's anything that might give me any clues as to what's gone on. And as I approach the patient from across the room, I'm doing patient assessment triangle. So specifically, I'm looking at the work of the patient's breathing, colour to skin and neurologic appearance. So neurologically they appear unresponsive, the colour to skin is pale, and when I think of work of breathing I can see that they're making ventilatory effort, but I can also hear a snoring noise, so I'm concerned about their airway. So as I approach the patient, quick shake and shout, hello, can you hear me? There's no response to that, so have a quick look in the mouth. Considering suction, I can't see anything in the mouth, so I just think for the moment I have an airway issue, so I'm going to get the oxygen, non-rebreathing mask, high flow oxygen, inflate the bag, pop the mask on the patient, and head tilt chin lift, and see if that helps the airway. So I do that for a few seconds. I can still hear the snoring noise, so I'm still concerned that there is an issue with the airway. So at this point I'm going to progress that to a basic airway adjunct, also considering ventilating the patient rather than just putting in the adjunct. But at the moment I know that they're making respiratory effort, so I'm going to leave that. I'm going to size the airway adjunct from the incisors to the angle of the jaw. Remove the mask, have another look in the mouth, consider suction. The airway is clear, mouth is clear, so insert the airway upside down, advance, rotate and advance again. Mask back on, and this time I'm going to do a bit of a jaw thrust to see if that helps. Again, considering ventilating the patient, but they're making effort, so I'm going to leave that at the moment. Their effort's about 6 to 8 a minute. So I do that. Okay, patient's still snoring. So I'm going to advance this up again to an eye gel. So I'm going to leave all of that in position in case it is doing some good. And just get some of the bits and pieces ready. Okay, we'll say the patient's about 70 kilos, so I'm going to take a size 4 eye gel, which is between 50 and 90 kilos. Do my fit for purpose checks, take it out of the pack, lube the sides and the tip. Just get that ready there. Get out the bag of mask, because I'm going to have to ventilate the patient when I've got my eye gel in. Okay, so take the mask off. I'm going to get rid of that now, because I'll connect the bag of mask up shortly. Take the airway out. Take the eye gel, put the head in the sniffing morning air position. Just advance the eye gel into the mouth until I feel resistance. Easy cap on top of that, then the catheter mount. Then the bag and mask. I'm just going to check my placement. Good air entry, good air entry, good air entry, good air entry. So I'm happy I'm in the right place. I'm now going to continue to ventilate the patient around every 6 seconds, but keeping an eye on the easy cap to see whether I'm getting the right colour come back or the right figure if I'm using a different device. I may put the patient on a pulse oximeter as well, so that I can keep an eye on that. And then just tying the tube in. Okay, and then I can reassess again if I want, and connect that back up to the oxygen.